Hi, my patient is a 22-year-old female soccer player. She reported to athletic training room on September 12th and complained of pain on her left ankle as well as a blood blister that was giving her issues in her cleats. She said this started approximately 2 weeks ago. She thought nothing of it had caused her no pain until the previous night on September 11th. She began to feel some pain and then woke on September 12th to a throbbing pain in her ankle. She states that she has pain about a 6 out of 10 when she walks. When just sitting in place, a 2 out of 10. If she presses on her ankle, she says it is approximately a 4 or 5 out of 10 for pain. Upon inspection, this blister appeared almost black in the middle and had significant bright erythema surrounding this blister, as well as lighter erythema spreading out up to 2 inches in diameter. Compared bilaterally, there was significant swelling, inflammation just around the lateral malleolus of her left ankle, with a bubble of that inflammation being over the ATF. Her skin, compared bilaterally, felt warm to the touch on her left ankle and had pain just upon slight palpation of the skin. Noticing that this was a serious infection, she was referred immediately down to Essentia. There, they incised and drained this blister, and there was blood as well as pus that came from this blister. It was then cleaned and covered, and patient was prescribed antibiotics, which she is to take for 7 days, twice a day. The doctor commented that it would be okay for her to practice and to play games as long as her wound was covered until it is fully healed during those practices and games. When she is at home, as long as her feet are kept clean, she may keep this open to allow air to get to the wound. The doctor also made the incision large enough that the wound would stay slightly opened so that it would also be able to drain further. The ongoing plan for this patient is that she is to report to the athletic training room prior to any practices or games each day until this wound is fully healed, for the athletic trainers to assess whether progress is being made or if she is getting worse. Patient was educated on how to keep the wound clean and what to do if it got worse. If her pain or the erythema were to increase, then she was to go back to the doctor or possibly to the emergency room if the pain was severe enough. With these bandages over her left malleolus for practices and games, she has no other limitations. Once her wound is healed, precaution will be taken to prevent further blisters from happening.